Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today's discussion will touch on a few recent updates. First, we'll be talking about transitioning TNAs into CNAs, and then we'll discuss ROP Phase 3 updates related to services and training. Everyone has entered this meeting on mute, but we will be taking questions during the webinar. So if you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We will also have a number of links that we will be sharing today, so keep an eye on the chat for those resources. And if you are listening to a recorded version of this webinar later, I will include the links in the show notes. We encourage you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, for next week's webinar, we'll be talking about updates to COVID-19 guidance, and that will be a rebroadcast of our October 19th meeting, but we will have a live Q&A with our health experts. So if you missed that webinar or would like a refresher, we invite you to join us here again next Wednesday at 2 p.m. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Deborah Wright. Deborah is a quality improvement specialist at Quality Insights. She joined our team after being in the long-term care industry for more than 30 years. She has a wealth of experience in long-term care nursing and management, ranging from certified nursing assistant to vice president of healthcare operations. She is most passionate when working with the MDS process and quality improvement. So Deborah, welcome, and thank you for joining us again today.
Thanks, Kathy, and thanks everybody for joining. We have lots of things to discuss today, so we're going to jump right in and start by reviewing what hopefully you already know about transitioning those TNAs to your CNAs. On November 3rd, most nursing homes, most administrators should have received a joint letter coming from not only Department of Health, but also Department of Human Services and the Department of Education. If you don't recall seeing or receiving that letter, Kathy's going to be dropping a link in the chat, and that basically explains everything that was in that letter that went out to the facilities. So we're just going to review a few date-specific items as it relates to that transition of your TNAs to your CNAs. The first two key points are ones that you should have already completed or totally stopped doing. So as of June 6th of 2022, TNAs were no longer to be hired at your facility. So hopefully you are no longer hiring a TNA. And also, as of last Thursday, November the 10th, all of those TNAs that you have on staff should have completed an attestation form, submitted it, and have it approved so that they can continue to work as a TNA while they are going through their final testing processes. If they have not completed that attestation at this point, technically they are not to be working as a TNA any longer. So there are two other deadlines that you need to pay attention to. The first one being December 31st. As of December 31st, any TNA that you still have working with an approved attestation form needs to go online and pass the written test. So we all know that there's been delays in the credentials testing registration, but supposedly there's no delay in obtaining the written exams because they're doing them online, they're readily available, and once you go in and request a test date, you're typically scheduled within 24 hours for that test date. So there's a couple things that you want to look at as you're getting your TNAs ready to take that written exam online. And it's basically the same as what you would do as your nursing assistants that you had in training as they were preparing to take their certification test. You want to work with them on test taking. So if they go through the registration process in the CNA 365, which is where they would have gone to upload that attestation form, you would create an account in there. That's where you would request your test. When you go onto the Credential website, there will be practice tests. So you want to, if you have those TNAs that you feel may not be good test takers or they're not comfortable taking tests, you want to help them go through that practice test. Make sure they have a quiet spot, a computer with reliable internet, that they know how to use the computer. You know, sometimes that could be a challenge and a barrier for some of your CNAs. So you want to make sure that they know how to use that computer. The other thing that you want to make sure is when they are sitting down to take their official online test, that they need to have a smartphone, because when they start taking that online test, they're going to have to do a security scan of the room that they're in where they're taking that test. So if you need more instructions or materials on taking the written test, you want to make sure that you review the Pennsylvania's Nurse Aid Candidate Handbook. And Kathy's going to be dropping a link in the chat for the most current copy of that handbook. And just like before, the TNAs are going to have 3 attempts to complete that written exam, but remember that they have to successfully have completed it by December 31st. So if they have not taken that written exam yet, that would be the first step that you want to do to get them through that process. The next deadline is for the skills exam, and this one's a little bit more variable. And the deadline is twofold. It's either at the end of the public health emergency, which was originally January 11th, but I am hearing that has been extended, or no later than January 5th. So whether it's been extended or not, if it's not January 11th and it's been extended, the absolute drop dead date for them to successfully pass their skills test is April 5th of 2023. So at that point, after April 5th, TNAs will be no longer, they will have to be CNAs, and they'll have to be on the registry and then working as a CNA, not a TNA at your facility. So this, unlike the written exam, the skill exam, you still need to do in person with that RN exam proctor, and it can be completed before or after the online written exam. And just like the written exam, it's going to be important to prepare your TNA for taking that exam. You want to really review that Nurse Aid Candidate Handbook. And it's going to be important to review the order of each step for the skill, because that's how basically they're going to be graded. So, you know, so many times, even when we hosted CNAs students in our facilities and they were doing clinical, you know, they're working with CNAs and they're learning the shortcuts, but there's no shortcuts when they take that test. And it's real important that the skills in the candidate handbook, that's what they'll be tested on, and they'll be tested on the correct step order. So you want to make sure that they really review that, and you kind of put them through some challenges and demonstration back to you so that you know that they have the correct step order before they go to take their test. So again, those deadlines are January 11th, or if the official extension of the public health emergency comes out, then the final deadline is April 5th. Now, not only do you have the 3 attempts to pass that test, but it's also going to be real important to remind your TNAs that if they have a scheduled test and they don't show up, that still counts as a failing attempt for passing that test. So it's going to be real important when they schedule it that they show up so that they get through that training process. Does anyone have any questions on the TNA process at this point?
So if you have questions, you can drop them in using either the chat or the Q&A feature, or you could raise your hand if you would like to be unmuted to verbally ask your question.
So are they opening up more sites? I really don't know the answer to that, Sonia. I know that they are saying that they should be able to meet this deadline. So I am hopeful that there are sites that your staff can go and get the testing.
Someone said one more site was opened up closer to us. Yes, very helpful.
Good. And the other thing is we're seeing more facilities that were approved in Department of Education to have CNA classes. If you know of a facility in your area that has those CNA classes, buddy up with them, even if maybe you don't take the classes with them or affiliated with them, maybe you could get added to their test date. I know that there are people that have done that, and that's been helpful and successful. So if you know people that are constantly working with getting groups of trainees or TNAs in testing, maybe you can collaborate with them and get your TNAs added to their testing group.
Someone asked, are students who passed a CNA program covered under the TNA extension?
Students who passed a CNA program covered in it, they would have the same, I don't think they would fall into this guidance. So they have their timeline to pass their test, and that's what they would follow. So if they've taken the approved NATs, what is the initials, NATCP course, then they would follow those guidelines for passing the successful test. This is just for the TNAs.
So that's it that we've had so far. There's nothing in the Q&A. Do you want me to share my screen as we move on to the next part?
Yep.
Oh, wait, we got another question.
So if the student is a TNA and they do not pass after the 4 months, can they apply for the extension? No, after April 5th, if the public health emergency gets extended, then April 5th is a drop dead deadline to take that test and be certified. If they do not successfully pass the written and the skills test by that time period, or either time period that they've established, then they basically cannot work as a TNA and they have to enroll in an approved CNA program.
Got another question. Do you want me to read it out loud?
So has any of the advocacy organizations considered seeking extensions beyond the 120 days for students taking classes and not able to get into a test site at that time? So I do know that, the big advocacy groups like Leading Age and PHCA, they are constantly advocating for this. What will be real important for you to do is, if you are struggling with getting into that test site, is clearly documenting all of your efforts. I don't know, and I don't know that Department of Education or Department of Health knows what they're going to do if there are still test issues and it gets to be closer to April. So that's why it's going to be important to document all your efforts so that you can, hopefully we can use that as these larger advocacy groups are talking for us and trying to get that extended.
Okay, I think we're ready to move on to the next part. We'll have a couple more Q&A sessions. So if you have any more questions about TNAs, we'll come back to that. I'm going to share my screen now, Deb, if you think
Okay.
You're ready for that.
So what we're going to do is we're going to very quickly go through.
Deb, did you get the right screen? Is this are you seeing my PowerPoint?
Yes. Yes.
Okay.
So these slides are going to be available to you hopefully within the next week. So we are going to go through these pretty quickly. Our main focus, though, is to just let you know what F tags to look at for changes so that then you can review those at your own facility and review your policy and procedures and make sure that they're updated with everything that did change with the ROPs. And, they've been extended for how many years now due to COVID, but they finally went into effect October 24th, 2022. Last week, we reviewed the opioid changes. This week, we're going to just highlight different services and trainings that are affected by a number of different F tags. So again, we're not going to review each F tag in detail. We're just drawing your attention to what those F tags are and maybe some key points. So in looking at the services, the first thing is nursing services. And A lot of this is common sense to us, but it's stuff, with COVID, we may have gotten away from. So you want to make sure you're looking at F725 under sufficient staff, that you're providing licensed nursing staff 24 hours a day, 7 days a week. And most of their compliance for this is they're going to be looking at your PBJ reporting. So maybe you're not the one that actually completes your PBJ submissions, but you want to make sure that those that do realize how important it is to validate the information before it gets submitted into CMS. So the other thing that they're going to look at is the critical element pathways. So Kathy's going to bring up that website, which it'll be at the end of this PowerPoint. And we're just kind of going to go through it because it's, you go into the CMS website and sometimes it's like you're in cyber world. So we're just going to look at that just so that you can kind of see the chain of clicks that you would go to get to it.
Can you see it? Can you see it right now, Deb? Okay.
Yes. Good. Yep. So once you click on the link, which will be in the slides, you're going to want to go down a bit and you're going to go to where it says survey resources, and it's going to open up a zip drive. And for most computers, that comes up at the bottom of your screen. So then you would open up that zip file, and it takes a little bit to download it. And you're going to click on the second one where it says long-term care survey pathways. And then here are all the different critical element pathways. So in looking at nursing services, you're going to look at the one, I got to make this bigger because I can't see it. It's going to be the one that says competent staff. Sufficient and competent staff. There you go, Kathy. So as Kathy scrolls through this, you're going to see this is all the red are changes that have come with the ROPs 2 and 3. So phase 2 and phase 3. So these are all the areas, not only the black, because you want to make sure that you had those things in place prior to these changes coming in, but the red you really want to pay attention to because that's all the things that have either been changed or added. And when you look at just that staffing and competent staff, the amount that has changed in that is quite a, obviously quite a lot that needs to be looked at the facility level. But that's these critical element pathways are what Department of Health is going to follow if they get triggers to look at certain tags. So if you go back to that listing, you can see all the different areas that there's critical element pathways for. There's dining and MedPass and environmental service. There's all different things that you can look in. So that's where I would start if I was looking at these F tags and making sure that I have policies and procedures and processes into place. So Kathy, you can go back to the PowerPoint. Some of the other things, and then they also, in this, when you get this, it'll go through each, how the deficiencies are going to be categorized as far as level 2, 3, or 4 based on harm and potential for harm. Next slide. So the important thing on this one, I don't really quite understand the first bullet point that facilities are required to use the services of an RN for at least 8 consecutive hours a day, 7 days a week. We all do that. So if your facility, we actually have to have an RN on 24 hours a day, unless you're a facility that your census is 59 or less. And then you would have an LPN charge nurse on night shift and have that RN available within a certain mile radius should an RN be needed during those time periods. The one thing that they did write on here that they didn't really draw a lot of attention to is designating an RN to serve as your full-time DON. It's now 40 hours or more. It used to be 35 hours or more. And I do know that there are a lot of facilities that are starting to get deficiencies when, you have those staffing struggles that we know you're all going through, and your DON gets pulled to the floor to cover those hours. they're saying she still needs to work her 40, or he needs to work their 40 hours as a DON. So that's something that is becoming a real challenge for facilities as we're all still facing the staffing shortages that we're dealing with. Next slide. Again, this is the PBJ, which we've talked about. You may not be the one submitting it. A lot of you probably utilize a specific software system or generate your staffing reports. And I just can't stress enough how important it is that that person knows and understands how those PBJ reports are being pulled and submitted. And trust me, I've gone through a PBJ audit and it's not fun, especially if you don't understand the reports and how things are being pulled and submitted. Next slide. If they identify a concern, they're going to start looking at 729, 725, 726. They're going to pull nurse aid personnel files. They're going to verify their registration. They're going to verify their competencies. They're going to look at how long has that individual worked and do they have their new training and their competency evaluations completed. The other area that we tend to get ourselves stuck in a little bit is that nurse staffing posting that we need to do. So facilities are still required to post their staffing and their census information at the beginning of each shift. It has to be in a way that the general public can understand it and read it, and a place where the visitors and residents can see it. And then we need to keep those for 18 months so that they can verify that we did it. And, you know, a lot of times, not only do we get hit with not having it posted, but then not updating it. So if you post it for a 24-hour period, you need to make sure that you're going back and updating that as your census changes, or you have call-offs or replacements, and making sure that it's current for what you have for that shift. Again, the surveyors have information to all this, the PBJ reports and CASPER. So you want to make sure that you're meeting your deadlines for uploading your PBJ reports. And then physician visits, I'm not really going to go into this. If you go to the next slide, Kathy, there's a table. So when you're looking at that F tag, there'll be a table of, you know, for their initial visits, admission orders, other visits, certifications, who can sign it, the physician, a PA nurse practitioner, whether they're employed or not employed by the facility. And there's a whole table there where you can look at all that. So what do you want to take out of this? You want to make sure that you're looking at all those F tags, looking at your policies and procedures as they're related to physician and non-physician visits, making sure your Medicare Part A certification is being signed and completed by the regulation, making sure that you're updating the physicians on any policies and procedures that you change or review or update that involves their services. You want to make sure you have that PBJ report done timely, and you're reviewing all of the information in your CASPER reports to make sure that you are meeting your staffing needs and having that staff posting and census information available. So and then the rest of that slide deck is just screenshots of the critical element pathways and how to get to that. So I think before we open it up to question and answer, we'll quickly go to the training PowerPoint, Kathy. Look at that.
I have a lot of windows open, but I'm getting there.
That's okay. I'm looking
Okay,
at
here we
the
go.
chats while we're looking.
I think we got it. Okay, can you see it?
Yep. And then Rosine, I think that's how you say it. Can you give a URL for the critical element pathways? And yes, Kathy has put that in the chat, so you should have that. So then the F tags that go with your training requirements, start at F940. You're going to want to make sure that you determine what staff are going to complete what training, what, your new staff, your existing staff, volunteers, your contractual staff. And you're going to have to determine, based on completing your facility assessment, what type of training is needed based on the services that you provide. You're also going to want to make sure that you have effective communication regarding whether the trainings are mandatory, and how are you going to communicate that to them, and in a way that they can understand it and on a level that they can understand it. Resident rights, again, you just want to make sure that you're doing all of your training in regards to the resident rights. And again, follow those critical element pathways. That's the best thing that I can tell you, so that you're making sure you're hitting everything that's in the F tags that's required under each one of those sections. The QIN-QIO program is probably one of the biggest ones that we have seen lately. And, it's more than just checking a box that you held a meeting. It's finding what is your QIN-QIO meeting? What's the true purpose of your meeting? What do you hope to accomplish? What have you identified as challenges within your facility? And how do you hope to correct those issues that you're seeing? And again, in order to do that, you have to bring in the team members that are involved in it, not necessarily just the leadership staff, but maybe it's bringing in a dietary aide that's giving those supplements, or it's bringing in a nursing assistant who's providing the care or activities. You want to make sure you have the right people presenting and participating in your plan to move forward in making the best solution for the problem that you've identified at your facility. But then once you get to that point, the next step is making sure that all staff, not just the ones that were involved in the process, but all staff have been trained on the changes and their processes, and then tracking that training has been completed. And then infection control, we've all seen over the last couple of years how big infection control has become part of that training process. So you want to make sure that all of your training or your infection control practices and protocols that you put in place, you're getting that out there to the staff, and that they clearly understand what needs to happen, making sure that they are demonstrating back to you, you're doing those competencies and those critical element pathways, your observations and your audits, and making sure that the processes that you put in place are being followed through with. Compliance and ethics, this is one that's probably, we tend to bypass, but unless you're part of a big organization, you probably haven't really looked at a whole lot. So this is one I definitely would look at, because in my world, this would kind of be like an easy citation for Department of Health, especially if they know you're a smaller facility. So you're going to want to make sure that you provided a training program and a manner to effectively communicate all the standards that you have in place for your compliance and ethics program to the entire staff. You have to have a process in place to track that training, and you need to make sure that for if you're an organization and you operate 5 or more facilities, you also have to have that annual training for the staff. And there's a lot more that goes into that compliance and ethics. So I would definitely look at that FTAG 946 and look at the critical element pathways that go with that, because there's a lot of things that they have added to that, even for the smaller facilities. And then in-service training for nurses aides, it's the same that we've always done. It's a combination of in-person, webinars, virtual demonstrations back, competencies, but also, again, really looking at that facility assessment and what services are you offering to the residents that you care for. Is your entire nursing staff, not just the nurse aides, but in this tag, they're looking at the nurse aides. Are they clearly trained and have competencies on taking care of those individuals? Behavioral health, we talked about this last week with the opioids. So you just want to make sure you have that person-centered care and meaningful activities, that go along with your pharmacological and your non-pharmacological interventions, and that everything is care planned and resident specific. So again, it's, the takeaways are you want to make sure that you're reviewing all of those processes. You're looking at your in-servicing, you're looking at your training, you're looking at ways to track that training has been completed, and making sure that you have a process in place for reviewing and updating your policies and procedures or protocols. The other thing I just want to throw out there is that we heard yesterday where Pennsylvania, starting January, facility assessment is going to be changed from an annual review to a quarterly review. I have put out some inquiries to people of these bigger advocacy groups to see if I can find that in writing. I cannot find that in writing, and neither can they yet, but just something to keep on your radar and to think about come January if that facility assessment has been changed from an annual review to a quarterly review. And then for sake of time, since we are at the 2:30 mark, the rest of this is about dietary staff. So if you have specific questions regarding your dietary staff, you can look at this. They're talking about what now is qualified as dietary staff, 2 or more years of experience in their position as a director, and they have completed the food and safety management course by October 1st of 2023. And then just to go through this, some of the other things that they've changed is they've kind of separated food distribution and food services. So that they've clarified that food distribution is when meals are assembled in the kitchen and then delivered to the resident's room or dining room to be distributed. Covering food is appropriate, and whether it's individual or in the mobile food cart. And then they've added the definition for food service to state food service means the processes involved in actively serving the food to the resident, whether it's in the dining room, outside their resident rooms where staff are trained in serving the food, whether it's from a mobile cart or a steam cart, and whether that food needs to be covered, not covered, and how the food is covered as you're going down the hallway. And then the last couple slides, they just go into when you need to wear a hairnet, when you need to wear gloves, and they're just clarifying all of that when you need to have each of those on. And then just making sure that whether you are serving the food, in the dining room, in their room, from a steam cart, from a tray, making sure you're keeping that proper temperature. You can keep going, Kathy, that's all the same. And then your action items are going to be, again, reviewing your policies and procedures and making sure that everybody has been educated if you change those policies and procedures from what your current standards are. So I know, again, this was a lot of information in a very short period of time. And again, our goal wasn't to review each F tag in detail, but just draw your attention to the F tags that have changes made to them. We will continue this series probably end of December, trying to get rest of those F tags out there to make sure that you're aware of all the ones that have had changes to them, so that you can take a look at the critical element pathways and the F tags to make sure that you've made the necessary changes. So that was an awful lot. So do we have any questions? When the regulations are talking about training on communication and other topics, do you think that means a one-time training for all staff, or would this be an annual training? So I think in regards to the changes, I think it means the training would be any changes. You've reviewed your policies and procedures. Have you made any changes? If you've made changes, then yes, those changes would need to be communicated to your staff, and depending on how involved the changes are, will depend on how much training you need. Is it a simple read and sign, or do you have to have a full in-service on the changes that you're making? And then as far as annual, that would be annually would be if it's in those mandatory annual trainings that you need to have, or if it's something that you determine as a facility that's something you want to remind your staff about on an annual. But certainly anytime you make changes that involves your processes, then those that are involved in carrying out those processes would need to be trained.
So another question that we have is, can you list the 12 hours of in-service training for CNAs?
I knew that was going to come up. We will, when Kathy sends out the slides, we will put the 12 hours, what they are, we will include that in that.
I had one person ask, they said they missed the beginning about the TNAs, and yes, we've already covered the TNAs, but I will be emailing the recording to everyone who registered today to the email address that you registered with, and I'll send the recording and the presentation slides, and along with any other information that we need to attach for your resources. So yes, that will be coming probably Friday. So that's the questions we have so far. I'm going to run through a couple of quick housekeeping items, but if you have any questions that you would like to ask, it's not too late. You can put them in the chat or use the Q&A tool. And then you could also, if you would like to speak your question aloud, you can raise your hand and we can give you the option to unmute yourself. So while we're waiting, I'd again like to invite everyone to join us for next week's webinar. It's also at 2 p.m. Wednesday, and we will be, sorry, I lost my place. We'll be reviewing updates to COVID-19 guidance that affect nursing homes. So that was a webinar that we had about a month ago, and we'll be rebroadcasting that. And then we will also have our team here on that call to answer any updated questions that people might have. And then we also have office hours twice a week, which are kind of like live chat rooms where you can stop by and someone on our team will be there to answer your questions or comments. So if you have any questions that you don't get to today, we invite you to join us during our office hours, which are Tuesday at 8 a.m. and Thursdays at 2 p.m., except for next Thursday, which is Thanksgiving. You can find the links to our office hours and webinars in the newsletter that we send out each Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me and I will get you on that list. And I will drop my email in the chat shortly, along with Deb's contact in case you need to get in touch with her. My email is ccaudell@qualityinsights.org. And let's see, it doesn't look like we've gotten anything else in the chat or the Q&A. So I'm going to drop my email in real quick. And I might also drop in some of those links again that I posted in earlier. I think if people come in later, they might not be able to see the chat items that we put at the beginning. So I'll go ahead and drop those in again while we wait for people to come back in. Or to ask their questions, sorry. So those are some of the resources that we had at the top of the discussion. Okay, so I don't see anything else in the chat or the Q&A, and it doesn't look like any hands are raised. So I think we can wrap up. I'd like to thank you all for joining us today. If you have anything that we didn't get to, you can email me or Deb if you have any follow-up questions. And I'd like to thank you all for joining us today. Hope to see you back soon. And Deb, thank you for sitting down with us and giving us this great overview again.
Thanks, Kathy.
Bye, everyone.